Sudan's healthcare professionals are sounding the alarm over a silent emergency. It's been 100 days since US President Donald Trump cut foreign aid. And it has left doctors and midwives on the ground grappling with how they can treat pregnant women in conflict zones.
We examine pregnant women, guide them, and do monthly follow-ups. The hardest case I faced was when a woman delivering in a car had complications. But there was no way to get to the hospital. We were stuck in the car.
Doctors Without Borders CEO Avril Benoit says the funding cuts is a human-made disaster for millions of people struggling to survive war and emergencies. Adding that her team of doctors in more than 20 countries around the world have reported disrupted or suspended reproductive health programs, which relies on referrals for medical emergencies and supplies in areas that are already facing high levels of maternal and infant mortality rates.
I've cried many times, especially when women can't reach us to get the care they need.
In January, the UN estimated that around 2.7 million women of reproductive age are displaced in Sudan. Of those, more than 270,000 are pregnant, and around 91,000 were expected to give birth over the past 3 months, and may have no choice but to deliver their child in the open without trained doctors or proper medicine. The UN Refugee Agency says some who have managed to flee across borders into Egypt are being forced to wait for treatment too.
In Egypt, this has become very noticeable with the Sudan crisis, where basically the allocated funds are the same, while the refugee population has more than tripled.
As vital medical resources begin to dwindle in Sudan, it seems lives are no longer just at risk from bullets or famine. Now doctors and midwives face an impossible choice: to help or to turn patients away, highlighting that urgent funding needs to be restored or found elsewhere. Kristina Simich, TRT World.